Hi, everyone. I'm Sheila Horvitz. This is Talkback. And during this coronavirus time, when everybody is at home and maybe has more time to think and reflect on things, we're having shows about all different parts of human experience, from our politics to our arts to our culture and to our medicine. We had the opportunity to speak to a nurse who was working in the COVID-19 sections of a hospital in Boston and saw what she was going through in her patients. And we have the resources of someone else who's very special, who gave us a very important talk the other week about the stresses and tensions of living through this time and how we can try to heal and how we can try to ease those stresses and become, as he puts it, calm amidst the storm. So let me introduce again Dr. Paul Epstein. Hi, Paul. How are
Hi,
you today?
Sheila. I'm fine,
Good.
thank you. Happy to be
Okay.
here.
Great. Paul happens to be my actual brother. And we grew up together in New York City, in the Bronx, and in Little Neck. And we lived during a time in the 1950s and 60s where medicine really meant, right, Paul, our family doctors, the family doctors who we relied on for everything in life, who in those days even came to our homes, remember?
Hmm.
And we trusted them, but medicine meant maybe the hospital, maybe a surgery, maybe a prescription. And there wasn't much thought of how your whole self, your mind, was connected somehow to that body, right? Back in those days.
We were holistically oriented in treating the person, but weren't engaging the mind as much and emotions as much and stress with what we know now, how to work with that and help with healing and deal with
Okay.
the symptoms
Because
of that.
50 years ago, nobody talked about meditation as medication. Nobody talked about the expression you use, the body bears the burden and mind body. So let's start with you. What made you, when you decided to go to medical school, what made you go to naturopathic school instead of a more traditional medical school?
Well, my initiation into another approach to health and healing was through the practice of yoga and meditation, for my own personal development, evolution, healing, my own stresses of life, my own questioning of who am I and what do I want my life to be about, and what kind of work do I want to do. I was still young and in my 20s and exploring my own path. And as you know, Sheila, our father passed away rather suddenly, even though he had a heart condition. Um, and as I share with um, my talks, he passed away from heart surgery, bypass surgery, on the operating table, which he unfortunately wasn't able to survive. And the story of his life and the stress of him being a survivor of trauma from World War II, having been a soldier on the battlefields and having been on the beaches of Normandy, um, that trauma affected him in ways that helped contribute, I think, to his illness, among other factors. And so, as I evolved for myself in studying yoga and meditation, I became a teacher, and a lot of people would come with stresses and health concerns, and I wasn't treating them because I was just a yoga and meditation teacher in that sense. But in those days, this was the early 70s, where people will start beginning to look for options and other approaches for self healing. And I was watching people get well by changing their diet and dealing with their stress and learning how to breathe and doing yoga and meditation. And I was at a point where I was still exploring my career. I was thinking of teaching, and I did some teaching, and I did some social work, and was going to school for various particular areas of focus. I got so interested in the experience of helping people heal themselves, mind and body, that I decided to go to back to school for pre med, And in that point, I answered the question that you asked: why did I choose this kind of medicine versus a more conventional approach of drugs and surgery? And again, for me, the work was to support people, empower people to heal themselves, having witnessed it as a yoga and meditation teacher for many years. And so that's where the sense of integration comes in, where our healthcare system needs the best doctors, the best surgeons, the best medicines, the best medications. As we know in our present situation, we're relying on the system to keep people alive with ventilators and being able to support them to prevent this virus from being worse than a bad experience in terms of being able to survive it. And we're hoping that we come up with medications to treat this virus. We're also hoping that we come up with a vaccine to prevent us getting it altogether. But in the meantime, the stress and trauma of the anxiety and uncertainty is creating in people, I think, the seeds for new symptoms, new ailments, an exacerbation of old ailments, so that as we're going through this trauma, I sense many people, hopefully not, but if we learn how to deal with the mind body connection now, a year from now, when hopefully this is all over, we won't still carry some of that stress and trauma. And that's what post traumatic stress is. That's what our dad suffered from: post traumatic trauma. He had
Okay.
PTSD. And so
Okay.
we want to
Let me.
prevent that.
Okay, so let's go back a little. So you went to naturopathic college, and I know, being involved with you all these years, that you worked hard to overcome some of the myths and the opposition to the kind of medicine that you wanted to do. And now you were a pioneer, because now 40, 50 years later, the kinds of things that you're talking about are resonating with people.
Yes.
More and more people are doing yoga. More and more people are doing meditation. More and more people know what mindfulness means and how important that is. More and more people are taking advantage of Eastern cultures and the kinds of philosophies they had that help to calm us and to bring us more serenity and more peace. So you were a pioneer, and so what's so important, and I know I always had to tell my friends and associates, it's not an either or situation. It's not do
Mhm.
quote natural medicine versus surgery and pills and medication. And you just pointed out how important the difference is. How
Yes.
long? So at what point do you think it started to come home to you? Wow, people are getting it. It's not an either or situation. We need both equations in the work that we do to heal people.
Well, it's a process. And the other important context here in my work is a lot of those are self-care practices that are important and wonderful, because in medicine we have three perspectives and three approaches in our intention. Obviously, we want to treat the disease. We don't want it to get worse. We want to treat it so we're getting to the bottom of it and eradicating that symptom, be it what we're dealing with now with the virus, or heart disease, cancer, diabetes, irritable bowel syndrome, migraine headaches. We want freedom from the symptoms. We want to treat it. We want to cure it. So we do treatment. And mind body medicine both is being recognized as a support to calm you down and to help lower your blood pressure and deal with your anxiety. And those factors are critical and important from a relaxation and a stress management end. My work as a specialist in mind body medicine is to integrate that into the treatment of your disease. For many people, even if they're treating it with the right diagnosis and the right specialist, the underlying cause of the disease, and this is what's important to emphasize, it's not just the use of different therapies that is coming into vogue, it's also the shift in perspective to understand the underlying intention of how and why we use that. And in that context, the underlying intention first and foremost is to treat the underlying cause, asking, how did you get like this? What happened? Why are you in my office with asthma and allergies and arthritis and etc.? And we now know that many chronic diseases have as their predisposition and their underlying cause is the stresses and traumas of life, both immediately in what you're living now, what you may have gone through the past. And you know this, Sheila, as a divorce attorney, having in your career worked a lot with domestic violence. That's a practical term. You help people legally with extricating themselves from those relationships and financial and otherwise. And you know the toll that that stress has on it. And so my work is to integrate and engage the person to more fully explore how to heal that, to use their pain, their stress, their illness as an opportunity to transform it into a journey of healing and awakening. So, on the
Okay.
one hand, if I have a headache, give me the pill so it goes away. If I have a cancer, cut it out so I'll survive and it won't kill me. That's important, and we need to do that. On the other hand, there's what's the underlying cause? How did it come to be this way? Not at your fault, and that's often a combination of genetics and environment and lifestyle. And so my work is integrating that for the client to recognize what role can you play in your healing, and more for the chronic diseases of our society, they're lifestyle diseases. Even now, even though we're looking for treatments for the virus, looking for the context of a vaccine, what we do, whether we socially distance, whether we're washing our hands, whether we're wearing a mask or not, how we personally take care of ourselves actually has more impact. Hopefully, we find those drugs and that vaccine comes. But until then, we're the ones, and how we choose to deal with it, that's going to determine to a large degree whether we're part of that spike or whether we're staying safe. And
Okay, so let me ask, let's go down to terms. Let's get specific because
sure,
we know there has to be a scientific basis for all of this. After
yes,
all, you are a medical doctor, and
yes,
everything you do is based in science. It's not superstition.
oh,
It's
it's
not
science.
la la
Yes.
land. We're talking science. So, what is, when you say, what is the mind body connection?
Okay.
Why do I know? Why do we know that the diseases that we have are connected to the mind and the issues in our thoughts and our mind? How is there the connection? What's the basis for that?
So just to clarify the language that you used, because it's important, I am practicing medicine. I'm practicing naturopathic medicine. I am licensed in the state of Connecticut. I'm covered by most insurance companies. In that sense, I'm a medical professional, but I don't refer to myself as a medical doctor. I'm a naturopathic doctor practicing natural medicine and integrating that way. That's just a term that's important. Back
Okay.
to the sensitivity of that. Now, answering that question is very simple as evidence is overwhelming. The American Academy in US, why do I do this work? The American Academy of Family Physicians has done much research, and they have found that upwards of over 80% of visits to the family doctor are for stress related complaints. That's the family doctor. When your family doctor can't help you because your disease has gotten worse, you end up in the hospital. And those doctors are wonderful because they're trained to treat you at a later stage in the disease process. But the underlying cause may still be stress and lifestyle and trauma. That's number one. Number two, when we began to look particularly at the mind body connection, I will start with my profession's first and foremost foundation, which is nutrition. Everybody knows. Go to the Heart Association, Cancer Society, Diabetes Association. What do they talk about? Heart Association, make sure of your cholesterol, lower fat, meat, eat less meat, more vegetables, etc. I'll be very brief on that. Cancer Society, don't eat foods with chemicals in it. We know what causes cancer. Stay out of the sun. Do things that are preventive. Eat a healthy diet. Get checked for your colonoscopy on a regular basis. So there's a preventive level and a treatment level. The same treatment for heart disease and cancer and diabetes. Diabetes, what? Sugar. Be aware of your sugar. So as a profession, we now know how important diet and nutrition are. And you would be amazed, and this is not to be critical, but I would be amazed. I'd see patients with irritable bowel syndrome and digestive problems, and they're seeing the best gastroenterologist in town, and he had no knowledge of nutrition because they don't work on what the diet is. They work on what the symptom is and how to treat the condition after you have it. And so, from a mind-body standpoint, the research is overwhelming now, and you ask for scientific terms, I will give them to you. Number one is neuroplasticity. That's the exciting reality that our brains can change. We are all subject to past conditions and patterns and ways of being. This is what therapy is about on some level. Can we change? Can we change our habits that have evolved over time when they cause us difficulties or they bring us stress? One of the ways that we can change those habits in the brain is through meditation. It creates new neural pathways through meditation practice. So a lot of research is done on the brain and neurology and the effect of meditation for healing. My work is to integrate that with the disease and the person and their consciousness. The second area, which is critical now in terms of the virus and who gets sick and how it affects us, that's the nature of our immune system. Stress affects our immune system negatively. Psychoneuroimmunology is the study between the connection between stress and the emotions and the mind-body connection. Again, when I'm seeing patients, people, even though this is what I've been doing for years, not because the other part of being a naturopath and herbs and vitamins and Chinese medicine isn't also important, and not because diagnosis and drugs and surgery aren't important, but this is a component that I'm interested because of our dad, that I don't want people to bypass the real healing of what's really going on. And so we now have, when you deal with your stress, you're strengthening your immune system. So when you meditate, you ask this meditation as medication, it's strengthening your immune system. And here's another thing that affects you and I. There is such a thing called epigenetics. Usually we inherit tendencies through birth. Epigenetic means after birth, people, here's a something that is not exactly definitively understood, but we're exploring it more and more. When I practiced in Israel and more now, they're studying from a genetic standpoint that children of Holocaust survivors may be more susceptible to develop symptoms of PTSD that they inherited epigenetically by living with someone who does that. In the same way, people who grow up in alcoholic homes, or I know what you shared when we've talked about your work with domestic violence, children in domestic violence home have what's called an ACE, an adverse childhood event that sets them up for illness later in life. So these sciences of neuroplasticity, these sciences of psychoneuroimmunology and epigenetics emphasize your mind is a healer or your mind is a slayer. Equally with that are the studies, the epidemiological studies, looking retrospectively in the back to say, why did people get sick? And finding out that the underlying cause of all these diseases, you end up with diabetes and heart disease and cancer, not because it's your fault, but because it's been conditioned through the patterns and traumas and stresses and lifestyles that you've been attributed to. And so
Okay.
that becomes a way of working with all of that.
Okay. So let's talk about meditation as medication.
Okay.
Because I know so many people would love to be able to do it, would love to be able to feel that calm, that serenity that comes from being able to wipe everything off the slate and listen to your breath and meditate. So let's tell us, Paul, and then maybe we can do an exercise before we leave. How do we go about meditating? Do I sit down in a chair, on the table, on the floor? cross my
First,
legs?
okay,
What do I
first,
do
first, first,
physically and
yeah.
so forth? Go
So that's
ahead.
so I must provide the proper context and intention for the practice before I teach you that, because you might do the right thing in the wrong way and for the wrong reason. So, for your example, you had already began with a context of wipe things away. It's the opposite. To be calm in the storm is not to have an intention to wipe anything away, but to learn how to relate to it in a way that you neither freak out nor zone out, so that you can be with what is in a way that you stay calm and able not to push it away and not to get lost in it. That's called a beginner's mind. So there's three things, and then I will share with you what you asked. Number one is a correct context of what you said, which is how to do it. And on that level is to think of it as a training of your mind. It's not a pill that you take that you get an instant result. It's a practice that you have to evolve and continually work with, and see it as such that you're moving forward like any skill or learning anything. I like to think of it like training your puppy dog to focus and take a walk. You use a leash to control it in a gentle way. Meditation is paying attention and training your mind to be in the moment without reacting, without pushing anything away, without getting caught in anything, but staying calm in the storm. That requires a training of how to do it. And you're right, we use the breath as a beginning practice. The second element in the way that I teach meditation, both to students and to patients, is to understand the teachings, to understand, well, what's the purpose? Why am I doing this? It's not, if I meditate, all my pain's going to go away. It's not, if I meditate, I'm never going to have any stress. It's not, if I meditate, I'll tune everything out. It's, if I meditate, I have a better chance of being with what's happening with less reactivity. We teach what we need to learn, and you know me, I'm as reactive as anyone, and I have to take a breath, and I have to stay present, and I have to make a wise choice. So meditation cultivates awareness and an ability to choose how to respond instead of react. And I'll give you an exercise in a moment on how to do it. Okay, and I can even send you some information that you can post for how to meditate as a instructive experience for people. The third area is to apply and integrate your practice and the teachings in your life as best you can. And, if at first you don't succeed, because life is difficult, life is stressful. We've just, this is 2020. We went through a crisis in 2011. We went through 2001. We went through the 911. In 2008, we went through another economic crisis with the problem with the financial system. And here we are another 11 years later. This is part of life. We've been in the war in Afghanistan. And so we have to find a way to see the reality of that, make it better, but not stick our heads in the sand and not get overly caught in it. So how to practice? There's different approaches. There's not one size fits all. There are a zillion apps. I emphasize the teachings and the practice. And before we do, I'll just mention the three important intentions that I think are critical in practice. Number one, a beginner's mind. Don't start with, you can start with, I want to meditate because I want to learn how to relax and I want to be at peace and I want to help heal my headaches and but once we do that, we have a beginner's mind and we just let it go. We just do it. The second is non-judgment. We don't have to judge ourselves continually. I'm doing it right. I'm doing it wrong. This. So it's not to judge so much. And the third is to be patient. It takes time. And it's not easy. We have our patterns, we have life, we have reactivity, and the mirror is always there for us to notice ourselves. So that's what meditation is looking inside and paying attention to your own mind and your thoughts, your body and your sensations, and your heart and your emotions, and learning a relationship with them, reflecting on them. And this is the essence of the medical power of meditation, is it gives us the ability to be resilient, to respond, which helps our brain, helps our immune system, helps our genes. So how to
Okay.
practice? You sit down, and it's best to, you can meditate 24/7. It's just being aware. What am I aware of? But in order to cultivate that, formal practice, 5 minutes, get into a comfortable posture. A phrase might be, you're not too tight. You're not going, oh, I'm meditating now and I'm going to get peace. No, that's a little too intense. But so, oh, I'm meditating. I want to relax. I want to tune everything out. That's not it either. It's, I'm going to stay present. I'm going to be calm, like playing the violin or the guitar. We have to tune the string so it's not too tight and it's not too loose. It's practice. It's awareness. It's kind of like the leash on the puppy dog. You don't want it too tight because the puppy dog will choke itself when it's running away. And you don't want it too loose or it's going to go all over the place. You want a certain amount of tautness. And that's the posture to start. So you do that, and I'll guide you just for a minute. You close your eyes. You can do it open, but you don't create any tension or resistance. There's no forcing anything.
Okay, so let's ask the people that are watching to close their eyes and tell them first that we want them to try and get some education, do some more readings, and you're going to post some of the websites and some of the articles that maybe will help them learn more about the
Sure.
philosophy behind it. But let's just try a small exercise for a few
Okay.
minutes just to give an idea. You've given us a nice background for this. So let's go. I'm going to close my eyes and
Close the eyes,
let's go.
and then you tune into your breath, because the breath brings you into the present moment, into the now. That's what mindfulness is, living in the now. Be here now, not yesterday, not pulled to tomorrow. What's happening now? And we start with the breath. I'm alive. So notice your breathing. Just be aware. Now, your mind's already thinking. You already have what's going to be tomorrow, what you had for breakfast today. And that's okay. That's thoughts, like waves in the ocean. You can't stop the waves. You have to learn to surf them. You let them come and go. No fighting, no judging, no pushing away. Just come back to the breath. It's always there. You're alive. What does it feel like to breathe? That's what the experience is. Pay attention. And when your mind wanders, you bring it back. So it's training the mind to come back to the moment. This is beginning practice, just like training the puppy dog to come back to your side, or training the puppy dog where to go or where not to go in the home. It takes a while to train it before you let it off the leash. So that's the first step. Tune into the breath. Then we use the breath. We're still preparing to meditate. We're getting the environment and the mind and body set. So we want to now relax the body just by scanning the body and feel yourself in the chair and take a few deep breaths just to begin, and think of your feet and your ankles. And this is bringing your mind and body together through the breath, just gently inhaling and exhaling. And I remind myself often as I'm preparing to sit to practice, there's nowhere to go, nothing to do. I'm not trying to become anybody. I'm not trying to make anything happen. I'm not trying to get rid of this or get rid of that or feel this or feel that. I just want to let go and let things be just as they are. I'm not striving to make anything happen. And the challenge is I'm going to accept whatever is there. And maybe some sadness or some fear may arise. That's okay. I don't have to push it away. I don't want to get caught in it. I'm not, there's no judging. That's what's there. Oh, an anxious thought or a sensation in the body. You become aware that your back is aching a little bit. And again, it's not what's happening. It's how we be with it. How can I be with it? How can I respond? That's what meditation is teaching. A way of being with ourselves, our own mind and our own body, with a beginner's mind, with we can call it compassionate curiosity. So we scan the body, real, not even take long. Just go through the abdomen, the chest, and the back, and just bring the mind to be aware of the body and breathe. And that's the beauty of it. You're not really trying to make anything happen, just being with what is and accepting it, not pushing it away, not getting lost in it, not having an idea of what you want to have happen, although that's going to be there. I want to feel peace. Okay, back to the breath. My toe is throbbing. Back to the breath. Just like the puppy dog wanders to that bush or to that other puppy, bring it back to your side to train it. Ultimately, you can let it off the leash, but the beginning practice in meditation is often the breath. And you have to individualize. It's not for everyone. That's part of what I do as a doctor and therapist and teacher is I have to individualize these practices in a way that's helpful for the client in the mind-body connection, integrated with everything else. So we tune into the breath, we scan the body, we come into the moment, we have these intentions in the background, and then we observe. And we have a compassionate curiosity. It's really an inquiry. What's it like to breathe? And then your mind's going to wonder what I have to do tomorrow, what I'm going to cook for dinner. Oh, back to the breath. Lovingly, gently, just training it. Reminder, come back. That return to the breath, that training of the mind, is creating a new pathway in the brain. And it's not creating it by pushing away the old, but by allowing the old to be there, and from that, a new one. So I'm going to stop for a moment. I'm going to ring a bell, a meditation bell, which is also a nice aspect of practice, to just spend a minute in silence, a minute of mindfulness to practice. 1 moment, just watching your breath. Let the waves of the mind come, whatever's there, return to the breath, just for a moment of mindfulness. One can practice just that. Beginning practice of observation, mindfulness of the breath. Be here now, 5 minutes. Or standing online, take a breath and come into the moment and ask yourself, what's happening? How can I be
Okay.
with what's happening? How can I be here now?
Okay, great. Paul,
Mhm.
that was another great introduction to mind body medicine and to meditation as medication. I hope people will take it to heart and will understand that it takes a while to learn the practice and to do it. But as you said, even 5 minutes can bring some kind of, as you put it, peace among the storm, because we're all living in this very tense and difficult time now. So thank you so much for your information. We're going to post on the Facebook page of Channel 14 Norwich. We're going to post some of the websites that you're going to send us and some of the articles that you think are important. Okay.
Yeah,
And so,
I know you're shutting down. I just want to make one final context comment that I think will be important for
okay.
everyone. These are difficult times. And there's a lot of anxiety and uncertainty people are going through for different reasons, and a lot of difficult emotions. The other important part of this is that mindfulness, it's not just the anxiety, it's also to process some of the challenging emotions that people may come up with. There's anger, there's frustration, there's grief, there's sadness, there's fear. And the practice is really, really important to process them so we're not reactive in that way. So the other is to emphasize it's natural to be anxious during these times. It's natural to be worried and uncomfortable with the uncertainty that we're living with in terms of the health issues and the economic issues. The challenge is not all or nothing, it's how do we learn to be with them. And so, one final point to address understanding this, it's not let me meditate so I don't have anxiety. It's let me meditate so I can be with my anxiety in a different way. And when I change my relationship to it and I change how I look at it and I change how I be with it, it changes. If it's set up, I can't feel this, I don't want to feel this, it doesn't work. So whether it's a migraine headache that you're meditating because you want to get relief or treatment from it on that many levels, you can't approach meditation. I'm meditating to get rid of my migraine headaches. The
And I
meditation will
think,
help.
yeah. Okay.
And
I
or whether
think,
you're afraid because you got diagnosed with cancer, fear is natural. It's how do I be with my fear, not how do I get rid of my fear.
right. Well, I think if people learn about it and start practicing it, some of these concepts you're talking about will kind of unfold for them. So thank you so much,
Appreciate
Paul.
the
We'll
opportunity.
have you again. And thank you everyone for watching and listening to on Talkback. We'll be back next time with another interesting guest. Bye. Bye,
Bye
Paul.
bye. Thank you.
Okay.